Most adults with scoliosis are told one of two things. One, there's nothing you can do except wait for it to get worse, or two, surgery. But here's the truth. With scoliosis-specific exercises, many adults can reduce pain, improve posture, and regain their overall quality of life, and not end up having surgery. So today, I'm going to share with you the science behind scoliosis-specific exercise, show you what's actually possible when you take control of your scoliosis journey. Now, if you're watching this video and you're curious if scoliosis-specific exercises may be a treatment option for you, click on the link below and request a free discovery call, where I'll review your individual case and let you know what your treatment options are. Hi, I'm Dr. Gubbels, a specialist in the non-surgical treatment of scoliosis. Now, I believe ScoliCare is the world's leading authority in the non-surgical treatment of scoliosis in adults. It's almost a daily basis where I see an adult who thought their scoliosis meant they had to live in chronic pain and decreased mobility and reduced quality of life. You see, scoliosis is really common in adults. In fact, up to 68% of adults over the age of 60 may have some form of scoliosis. And while scoliosis can be complex, it's not hopeless. You see, modern approaches like ScoliBalance, a scoliosis-specific program, gives you tools to help better your life, gives us tools to help improve movement, manage pain, and even slow curve progression. And in some adults, improve overall postural alignment. Now, the problem with many scoliosis treatments for adults is providers tend to try and treat adult scoliosis the same as adolescents or kids. Scoliosis in adults is completely different. In idiopathic scoliosis, the spine is actually growing asymmetrical and deformed, and the treatments are designed to guide or control growth during growth spurts. In adults, it's a degenerative condition, whether it's a scoliosis someone had when they were younger and they now have as an adult, or it's a new de novo scoliosis that develops in adulthood. You see, scoliosis in adults is a degenerative condition versus when in kids or teenagers, it's the body growing asymmetrical. Let me explain. This is a great diagram that shows how scoliosis develops and progresses in adulthood. The first thing that happens is we get some asymmetrical degeneration, more degeneration on one part of the spine compared to the other. That causes the spine to be asymmetrical. You start to get a lateral bend or a side shift or a twisting in the spine. Now you have asymmetrical alignment, which causes asymmetrical loading. Basically, you are in a tug of war with gravity. And as gravity pushes down, if the spine is not normal alignment, part of the joints have more pressure and they get more force put on them, which causes asymmetrical loading. That causes more asymmetrical deformity. Then you get more asymmetrical degeneration. This goes round and round, and curves tend to continue to progress. Let's look at this example. Here you have an adult with a degenerative scoliosis. The posture is actually collapsing over to the side. And you can see, if you look at this, the disc is really big on the outside, but it's thin on the inside. That's asymmetrical degeneration. You also have more degeneration on the inside of the joints here. So you have this asymmetrical degeneration, which causes misalignment, which causes more asymmetrical loading, meaning there's more pressure on the inside of the spine, and that causes it to break down, decay, and it's this repetitive cycle that goes round and round. This is what it looks like when you look at the patient. You'll see them leaning over to a side, or from the side here, you'll see them actually leaning or hunching forward. This is what it looks like when you look at the adult from the outside. You see them leaning over to the side when viewed from the back or front, and when viewed from the side, you'll see them get this forward lean or forward hunch in their spine. Now, the challenge with adult scoliosis isn't just the curve itself, it's what comes with it. You see, whether it's persistent back pain, loss of function, the inability to do normal daily activities like standing or walking, that's where the real problem or concern is. In fact, this diagram really helps explain what the key concerns or problems are with adults with scoliosis. The number one motivator is pain, meaning people are actually having chronic pain that they're trying to get rid of, and that chronic pain actually leads to disability when someone is no longer able to do their normal daily activities. The concern is that it's going to progress and get worse and worse without surgery. So one of the big goals of treatment is actually to stop progression. And then the last thing in adults is actually aesthetics. A lot of people don't like how they look, where they're leaning to the side or they're starting to hunch over. So these are the main concerns in adults, and they're also the main goals: to reduce pain, improve quality of life, keep the curve from progression or from progressing, and then improve how someone actually appears aesthetically. Now, here's a problem with most treatments. Standard gym workouts or general physical therapy often doesn't address the true 3D nature of scoliosis. In some cases, they may even make the symptoms worse. So what makes scoliosis-specific exercise different? Well, we don't just strengthen the core or stretch tight muscles. We target the imbalances created by the curve itself. For example, in ScoliBalance, we focus on 3 key principles. 1, postural realignment, meaning teaching your body a new, healthier posture. One of the criteria for a scoliosis-specific exercise routine is that it has to actually put your body in a true 3-dimensional corrected position. 2, strength and stability. You see, adults over 60 lose about 1 to 2% of muscle mass each year and about 3% of actual muscle strength. Once someone gets over 70, they lose about 5% of their muscle strength every single year. So here we have this condition where gravity is pushing down and people are actually deconditioned. Their spine is degenerating, but they're also losing muscle mass and muscle strength at an accelerated rate. And the third focus is improving what we call activities of daily living. The rehab needs to be incorporated into the patient's daily activities. In older adults, this frequently means helping them increase their ability to stand, being able to walk for longer periods of time, having increased balance, reducing the risk of falls, and just doing normal things around the house. You see, even simple exercise, when done correctly, can retrain your body to better balance and overall alignment. Now, I've seen adults in their 40s, 60s, even up into the upper 80s make real improvements. The oldest adult we've treated at ScoliCare was actually 96 years old. In fact, I had a patient tell me this morning she's never done any type of exercise or physical therapy that was so specifically targeted to her individual spinal condition. Here's the deal. It's not about fixing the spine to look perfect or straighten your spine on an x-ray. It's really about restoring your ability to live fully, move with less pain, and stay independent longer. Now, to learn more about adult scoliosis, click on the link below and download our free ebook called Scoliosis Knows No Limit. And again, if you're watching this and you're an adult with scoliosis and you're wondering what treatment options are available to you, or if you're a candidate for scoliosis-specific exercise, click on the link below, request a free discovery call, or review your x-rays, and I'll let you know what treatment options I believe you're a candidate for. Now, to learn more about the best and most effective treatments for adults over 50 who have scoliosis, click on our next video, and I'll see you there.